Hey everyone, we've got a cool video here today all about hypnosis and how we treat things, because a lot of our students have asked the question, what can I treat as a hypnotist or a hypnotherapist?
All kinds of things, but we don't deal with disorders. That's not our field. These are labels that other trained professionals give to a client.
Okay, so let's say that you go to a family doctor or a psychiatrist or a psychologist or whatever it is. They might label a person as having depression or OCD, or we've talked about things like bipolar, right? In addition to that, they may give you physical diagnoses like you have diabetes or you have obesity, for example. Those are really just labels. And as hypnotists,
parasites.
Yeah, we don't go directly after a label. We're not going to give someone a direct suggestion in hypnosis. You are no longer a diabetic. You are not an obese person. You are not depressed.
And we've got to point out too, these labels are diagnoses. It's a proper diagnosis by a medical professional. And we don't even really care what it's called, what this label is, because we don't treat labels. But what we do deal with are behaviors.
And beliefs.
And emotions.
In fact, that's a really good way to think about it. So behaviors, beliefs, and emotions. And well, emotions, those are really feelings, right? Those are feelings. So what we call it, the damn thing, whatever it's called,
doesn't even matter.
Doesn't freaking matter at all.
Because we help people feel better.
That's it. We help people feel better, which really means that we help people move away from old and bad stuff
and towards new good stuff, so they could have something like a craving for sweets.
Okay, so let's say somebody comes in and they've got obesity. Their doctor said, hey, you're obese.
Morbidly obese.
I want you to lose weight because this is important for your health. We don't treat obesity directly, but if we interview the client, we might find, oh, they've got food cravings. That's a major
donuts
issue.
All the time. We can help with that. We can help reduce the craving.
Because that's a feeling.
But we're not treating obesity. What about something like sadness or grief?
So somebody comes in, they go, I have depression. As a hypnotist, I'm going to be like, whoa, I'm not qualified to deal with depression. But what is the emotion that you're feeling? Oh, well, I feel sadness or grief or whatever it is. Okay, well, I can help you learn how to be happier. We can de-traumatize past sadness or whatever it is and then build a positive future where someone feels happy.
And people have self-esteem issues all the time. We run into this very frequently. And as hypnotists, it's incumbent upon us that when we do work, we should always be building the person's self-esteem. That's just de rigueur. That's part of it. And it should always be built in.
Yeah. And the same thing would go for something like a fear, right? So if somebody feels the emotion of fear, and that could be fear of rejection, fear of failure, any kind of phobia, any kind of anxiety, any kind of worry about something in the future. And we're not going to distinguish here necessarily between anxieties and fears, even though they're technically different.
Not our place.
But we're going to help that emotion get resolved and build a new, better emotion in its place.
And things like resentment. You know, resentment is really toxic for your body. If you're holding on to resentment and unforgiveness and bitterness, it can be very bad for your health. In fact, some experts believe it's connected to rheumatoid arthritis. So we don't get rid of rheumatoid arthritis with hypnosis, but we can help people manage their pain. We can help people let go of resentment and hatred so they start to feel better again.
All right. So we thought we'd give you a couple of quick examples of how you might attack problems. And the first one was depression. We kind of hinted at this already, but the first thing that you might do with someone is to help them access happier times in their life. You could also build appreciation for themselves and self-esteem, right?
And for what's going on in their life that is good. What aspects of the cup are still half full?
And you can help them generate new behaviors to be happier, or what else can we do?
Reaccess old behaviors that were useful in the past. How did you used to be happy? How can we install that again?
Exactly. So that way, it doesn't matter if they call it depression. We're never going to call it depression. We're never going to treat the depression. It doesn't matter if they call it depression, sadness, or maybe just boredom.
Now, another example is something, let's say it's a physical problem like high blood pressure, hypertension. We don't have the person come in and hypnotize them and say, you no longer have high blood pressure. You know, you are no longer hypertensive. We don't do that. But we treat things indirectly as educators, as hypnotists, as coaches by helping the person deal with this through lifestyle changes, dealing with underlying emotions, stresses, and so on. We are supporting their beliefs that are useful. We're changing their emotions, and we're helping them have better lives and live better lives in the future.
Yeah, and in fact, you can tell if somebody comes in with hypertension, their doctor said, "You've got high blood pressure, you got to take this medicine." They go, "Hey, I don't want to take medicine. Is there anything else I can do?" Well, you can change your exercise patterns, your eating patterns, whatever it is. We can be there as a hypnotherapist or hypnotist to help them support those new beliefs, those new behaviors, which will result in new emotions, and hopefully that'll resolve their hypertension.
And because hypnosis is an amplifier of human experience, any of these changes they're making, whether they're changing how they feel, or we're giving them new empowering beliefs or creating new behaviors for them, when we bring hypnosis to the table, it makes all of these work even better.
That's very true. All right, so to wrap up, we are supporting and not undermining any existing medical treatments that are being done for a patient or a client, and this should be viewed as complementary to medical treatment, or if there's no doctor involved, it's just complementary to any other stuff going on in their life. We're helping people feel better and live better lives through hypnosis.
That's right.
So, hope you enjoyed that video. Make sure you, I did too.
I want to hit the bell.
Okay,
Make sure you smash that bell.
After you hit the subscribe button,
After you hit the subscribe button, smash that bell.
Smash that bell. That way you'll always get notified of our newest YouTube videos. So thanks again. We'll see you in the next video, and good night.